Tummy time doesn't always have to be just a child laying on their belly on the floor or a supported surface. Tummy time can occur in various other positions. We'll go through some together today and talk a little bit about when I recommend using these positions. The first one on the left is the football hold. This is great for really young children, especially maybe some newborns. And we can hold our child with some support at their chest, as well as using our hand underneath and through their legs. Right now, you see the child is able to explore the world around them. You can even move around while holding your child in this position, making them feel a little bit more comfortable. You can adjust your positioning to provide various levels of support depending on your child's needs. The next position that I recommend also is chest to chest. In the photo here, you see a caregiver lying on slightly an incline with their child lying additionally on their chest. This really provides opportunity to facilitate that caregiver connection, and it's a great opportunity for you and your child to engage together in this experience. You can either lay fully flat or slightly inclined depending on your child's skills. If you're lying fully flat, the child is having to work a little bit more to hold themselves up, versus if you're on an incline, the child also is a little bit more supported by you there. Next, we see a caregiver holding the child across their lap. Using one of your legs to prop up the child, they can then engage in tummy time on your lap. You can raise your leg up or down depending on how your child is responding. Lastly, we see a caregiver holding a young child on an exercise ball. This is a great position for the child to gain more stability and head control against gravity. The caregiver is going to position themselves right in front of them and hold on to the ball. You can slowly rock the ball back and forth so the child is actively working against gravity and strengthening all those head and neck control. Now I wanted to go a little bit into some specific considerations for children of different ages. Specifically, looking at toys and where we're placing those toys can be really helpful in facilitating a positive tummy time experience. For newborns to 3 years old, we really want to prioritize the use of black and white, red, or high contrast toys, as this is what children are visually attending to at this age. Things such as contrast cards, which you see in the photo on the right, or rattles that are black and white can really capture a child's attention and visually allow them to see them. For newborns, they're also observing objects about 8 to 10 inches in front of them typically, so using that to your discretion for where you're placing those toys when in tummy time can be really helpful. Next, for children of 3 to 4 months old, they're going to start attending to mostly primary colors. You can start using bright colored toys with multiple sensory elements. Maybe some crinkle toys, as shown on the right, toys with motion, water mats, or mirrors are really great opportunities to provide them with a multi-sensory experience when engaging in tummy time. At this age, children are also expanding their ability to reach for toys and visually track. So it's important that you take that into consideration when setting up the environment. You might want to use yourself to move the toy around so the child is reaching out for it. You might want to place it a little bit further out of reach so that they're really activating and reaching their hands towards those toys as a way to kind of promote other learning while in this position. And lastly, for children around 4 to 5 months, you can use toys of all shades and colors. And you also might want to find some toys that have cause and effect elements or move around. There's a little mirror shown in one of the pictures where the child can kind of push on it and it will roll a little bit. So kind of adding another element for them to engage with can really make this activity more motivating for children of this age. Like I mentioned before, really just making tummy time part of your routine is going to be super helpful in finding the time to do it and ensuring your child is developing all of those age-appropriate milestones. Some common concerns that we hear are, my child is too young for tummy time. Like I mentioned before, we don't need to do tummy time right on the floor right away. For newborns, using those alternative positions, such as the football hold or chest to chest, can really facilitate a positive experience for you and your child during tummy time. Another common concern is that your child is becoming really fussy when you try tummy time. Like I mentioned before, focusing a lot on regulation. We want to make sure the child is well fed, has a good adequate amount of sleep, and is well rested before trialing this position. Your child is working so hard to hold themselves up and to strengthen their head and their neck that it can be tiring overall. So, first, focus on regulation. Additionally, remembering that we want to start with small amounts of tummy time multiple times a day to ensure that it's a good experience and also just give a child the opportunity to take some breaks. Now, I want to cover a little bit about when to seek out some support. Um, Oftentimes, if your child is experiencing difficulty holding their head up and you're noticing minimal to no improvements with time, that might be a good area for us to receive some support. Um, like I mentioned before, following those age appropriate norms. So take a look at where your child should be doing, where their head should be at, where their arms should be at in that tummy time position, and then kind of seeing, are they aligned with those? It's okay, children are all developing on their own time frame. So we always recommend, don't worry if your child's not meeting every milestone right on time as deemed by some of our motor milestone checklists and online. But really just taking a look at how their body is responding to tummy time, how they're looking and actively exploring during tummy time can be a good indicator of whether or not we need to seek out some additional support. Additionally, if your child is typically presenting with their head tilted or tipped to one side while in tummy time or other positions, this might be a good reason why we would receive some support. Similarly, if a child is only visually attending to one side of their body or attending to certain visual field, whether that's up, down, in the middle, and we're not able to track our toys or kind of attend to things around us, we might want to reach out for some support as well. And lastly, despite trialing various strategies that we mentioned today, if your child is still frequently distressed with tummy time, it could be a good idea to seek out some support just to find some individualized strategies and assess some underlying concerns that might exist that might be making tummy time harder for your child. I wanted to take some time to talk about why it's beneficial to receive support early. Early support overall leads to better long-term outcomes. It also provides caregivers with answers, some support, and kind of some strategies that really can alleviate that caregiver worry. I know everybody wants the best for their children, so it's okay to ask some questions just about how you can best support your child and kind of see what other strategies are out there. Receiving support early also enhances the overall experience for you and for your child, and it allows you to receive individualized strategies that promote a child in developing motor milestones and meeting the child really where they're at. So then I wanted to talk a little bit about how does occupational therapy help? So occupational therapists are skilled at assessing and determining underlying strength or muscle tone concerns. This might be an area that might be impacting your child's ability to participate in tummy time and make it a distressing experience. So an occupational therapist can look at their overall strength and their muscle tone. Next, an occupational therapist can assess your child's progress towards those age appropriate milestones, which then allows us to provide those individualized strategies that are tailored towards your child's current level of functioning. Occupational therapy in general takes a very holistic, family centered approach. Here at More to Say, we really want to meet you and your child where you're at. We're skilled at breaking down and analyzing developmental concerns, creating individualized treatment plans, and supporting overall positive outcomes. So before we wrap up today, we want to go over some key takeaways. First and foremost, tummy time is foundational to so many age-appropriate milestones, specifically gross motor milestones such as crawling, sitting, rocking on our hands and knees, walking, as well as other areas of development, including our visual system, our fine motor skills, sensory processing, and overall cognitive development, which are necessary for overall learning and development throughout the lifespan. In addition, we want to remember that starting early and slowly building the duration of tummy time is going to be the most helpful. We can use alternative tummy time positions, really use your caregiver connection, how connected you are with your child helps facilitate enhanced tummy time experiences, and specific age appropriate toys to kind of motivate and encourage a child to actively explore and enjoy the tummy time experience. And lastly, just it's really crucial that we seek out support early on in a child's life. If you're concerned about anything that you're noticing, it's always important just to ask some questions and maybe pursue an evaluation. We don't want to just wait out and see how the child is going to be doing because we're kind of losing some time where we can really support and assist them. If you're unsure if your child can benefit from services, we always recommend that you pursue an evaluation. For our services at More to Say, we don't require referral. However, we will coordinate care with your child's pediatrician by sending up over the evaluation write-up and coordinating on their plan of care. If you're interested in pursuing services, you can contact us at this number below, 203-828-6790. You can also submit a contact form on our website or email us at info@moretosayct.com. Now, I just wanted to spend some time. If anyone has any questions, feel free to unmute yourself and ask the questions. But in general, thank you all so much for joining us here today and taking some time to learn a little bit more about how we can best support your children through the tummy time process.